So I reviewed why we're conducting trials of innovative drugs in countries that may not have access to them. And I think overall what we've learned is that moving trials outside of high-income countries has been a very prominent way that we've been running trials, particularly over the last several years, where we're now running many of our trials in low and upper middle income countries. And while I think this has been tremendous to be able to get access of novel therapies across the globe earlier, I think what we've learned is there are some challenges with doing this because there are some concerns about infrastructure across the globe, as well as some ethical concerns that can arise when conducting trials in different patient populations. Overall, I think right now what we know is about 1/3 of all trials that are run by high-income countries are being conducted in low and upper middle-income countries, but these studies are not uniformly distributed across the globe. They are being conducted in particular countries around the world and are omitting some regions where it has been more challenging to run trials. But some of the reasons that we are doing this is, one, clearly speed is a major incentive, because if you run a global trial, you get a large number of sites, you get very broad patient populations, which allows sponsors of these trials to be able to complete them very quickly, which obviously has some financial incentive. But on the flip side of things, we've learned that the regulatory components surrounding these trials in high-income countries are quite challenging, and this makes the incentive to run trials in high-income countries a little bit lower for many sponsors, and hence the need to move to low middle-income countries. It's also been important because it's allowed us to enroll diverse patient populations, and we know patients of different races and ethnicities, for example, can have different metabolisms of drugs and experience different toxicities. So being able to study these drugs across diverse populations is actually quite critical. It also allows us to address some questions when we have a very rapidly changing standard of care environment, to be able to enroll patients who may be naive to some drugs in other countries as we begin to understand how all these drugs work. So I think there are lots of reasons that these trials are being conducted, but I think it's important that we continue this movement, because we do know that cancer is a prevalent problem across the globe. It is not just a problem in high-income countries, and mortality rates are higher often in these low middle-income countries, so we need to move towards that. But I think we need to figure out ways to do this better by building infrastructure, training investigators across the globe, and hopefully by doing this, we'll allow for patients not even on clinical trials, those people receiving standard of care, I think will also experience better care as we are better able to train healthcare providers and improve the infrastructure. So hopefully this is a good path forward, and it will help improve cancer mortality worldwide.